to elevate parts of the UK that are in tier 4, which is essentially the south of England, isn't it, into tier 5. We're not 100% sure yet exactly what this means. I think the rumours I'm hearing is that it might mean school closures and things, but we'll have to wait and see on the detail of this. Areas in tier 3 will go into tier 4, so we're hearing anyway. I mean, this affects literally millions of us. It won't affect all of us, doesn't it, really? We've already got 24 million of us living in London, the southeast and the east of England who are in tier 4. Apparently, the north of England
Dr.
and the
Pankhania,
Midlands
where
will
are
get
you
to
in
reach
the
the dizzying
UK?
heights of tier 4.
Bath.
Be sure.
Perfect.
But the big news for me today, anyway, apart from the fact that 51,000 of us tested positive for this virus, was that actually the Nightingale hospitals aren't really fit for purpose. In fact, they're being cleared out. Now, when we're talking about lockdowns, we consent to lockdowns on the basis that we don't want our NHS overwhelmed. Well, we cut the ribbon, didn't we, on these new shiny hospitals? What a national triumph that was. The army were rolled in, weren't they, to go and erect these Nightingale hospitals across the country? Well, the news today is there's only 28 people in them. That's across the UK. Apparently, the ones in Manchester, Bristol and Harrogate never even opened their doors. I'm joined now by Dr. Bharat Pankhania, who is Senior Clinical Lecturer at the University of Exeter's Medical School. Dr. Bharat, thank you very much for joining us today. How are you?
I'm very well, thank you. Good evening.
Look, I do want to start with the Nightingale Hospital issue. Is this a concern for you? These could be open, these could be treating people. Our NHS wouldn't be as overwhelmed, would it?
We have a big problem, and the big problem is that we haven't got the staff. We've had many decades worth of cuts in bed numbers as well as staff numbers. And to look after people on ventilators requires highly skilled, highly able staff to keep these very vulnerable patients alive. And we haven't got those staff. That's the problem.
Yeah, we've had a message in from Dave as well. You can join this conversation. Text, talk, and your message to 87222. He says that Johnson should be locked in a padded cell. He and his gang of 4 are mad and they are distorting our country. Thank you very much for your strong views there, Dave. It's fair to say. But is this a question now of actually Tory cuts are being shown up? They're being exposed for what they are, which is that we actually can't even staff these hospitals. Is there anywhere to hide now from the government for these cuts?
Well, we mustn't forget that the cuts started about 20 years ago. So I recall that we started on this adventure of reducing bed numbers and PFI initiatives, etc. So unfortunately, it's all the governments, all the colors, red, yellow, and blue, who are responsible for having got us to this position today.
Yeah, okay. Where are we with this vaccine rollout? Because it does seem to be taking its time. Are you confident that we will be doing this efficiently, or are there improvements to be made, do you think?
Well, I think vaccines are our big savior, because test and trace with case numbers reaching over 50,000 per day will not work. So the biggest savior we can have is restrictions on people interacting with each other to keep the case numbers down. And the vaccine, when and if it is licensed, what we can do is do the homework to set up a mass 24/7 immunization campaign that will cover the large population in a short time. That will be our big savior when we can get going.
Aren't there a lot of people that we're not using at the moment in the medical profession, maybe retired doctors and nurses or volunteers even, that actually could be roped in to staff Nightingale hospitals, help with the vaccine distribution and get the wheels of this country turning? And this is, of course, in light of the fact we're expecting potentially an announcement this evening about a lot of the UK being thrown into tier 5. So, if we had these people utilised fully, we wouldn't have to have our civil liberties curtailed, would we?
Unfortunately, we don't have these people. So people who have recently retired, etc., are already back. And I know many of my colleagues are back in face-to-face frontline seeing patients in NHS settings. Similarly, I have many other colleagues also taking part in the Pfizer BioNtech immunisations. It is a stark fact of life. Over the last 20 years, we reduced the number of NHS staff, and today with a pandemic, we have not got those specialist, well-trained, capable of looking after people on ventilators staff. That is
Yeah,
a fact.
we've had a tweet in from Darren. Thank you very much, Darren at Talk Radio. You can get in touch as well. We only spent 200 million quid on the he's talking about the Nightingale hospitals here. Who sanctioned that spend before realizing we didn't have the staff? Staff have come on the radio to say they would volunteer to work in their own time. Look, were you always skeptical about the Nightingale hospitals? Were you sitting there going, look, it's great that we've got these things built now, but did you always know that we wouldn't be able to use them essentially?
It came as a shock to myself as well, because I always defer to they must know and therefore they must have done their due diligence. Having said that, my favorite has always been that you enable the local hospital to expand its services. So having been a clinician, I know where all the other experts, etc., are, and I would like it to be an adjunct to my existing hospitals rather than a standalone specialist hospital for one thing only, people on ventilators. And unfortunately, we've been unable to staff them safely, and the rest is history.
Will we be able to staff them a bit more adequately if we vaccinate all of the members of our medical profession? What is the latest on that? Because these people seem like they should be first in line for the vaccine.
Even if you immunize the healthcare workers, the point is we just do not have enough of them to leave the NHS hospital and go to a specialist Nightingale hospital to do the job. And remember, a gravely ill patient on a ventilator needs about 4 or 6 or so nurses and healthcare workers 24/7. So that's a lot of staff required to look after a critically ill patient.
We have seen today another record number, of course, 51,000 people testing positive for coronavirus across the UK. It, of course, comes as Boris Johnson is supposedly anyway about to decide whether or not we go into tier 5, whatever this means. What's your take on the increase of cases? Is it that we're testing more people, or actually, are we essentially just spreading this around a lot more now?
No, no. Look, this is we've got rates per 100,000, so those don't reflect that we've just tested more. This is clearly indicating to us that amongst a population, we've got a lot of coronavirus in circulation, and it is a example. It is a clear indicator of human interactions and human activity. So cooler months. We've been out shopping, crowded buses, trains, etc. And the seeding happened. And having created the seeding from infected, infectious, maybe asymptomatic people, we've got the large number of cases today. And the Christmas cases are yet to come.
Well, this is the thing. Do you think actually that people behaving irresponsibly is essentially one of the major causes for this spread? Is it kind of our fault, really?
In many ways, it is a 50-50. So one is not giving out clean, clear, strict messages about what it is, what you can do, what you shouldn't do. And the other one is not implementing infection control measures rigidly. So give you an example. London is in tier 4. Here I am in the southwest in Bath, and we get reports of people having traveled all the way from their tier 4 to Bath tier 2 area to have meals out, etc. So it is all sorts of activities like those which we have never implemented properly, of restrictions mean restrictions, which has led to the rise in number of cases nationwide.
I think the big question that people are going to be asking, and you seem very well placed to answer it really, is that as we stand on the brink potentially of tighter lockdown restrictions, will tier 5 work? Do lockdowns work?
Yeah, it's a tough question. And now I feel we've run out of rope. And I honestly feel having patchwork tiers is not going to work. Like I just explained, Londoners can come to Bath and have a good day out. That's never going to work then. So what we either need is strict restrictions, which we're unable to do. So what do I feel will work? Immunizations. What do we do in the meantime whilst the immunizations are being rolled out? Hold tight, take cover, and keep your infection control measures up. That is all we can do. Personal responsibility.
Good stuff. Well, look, thank you so much for your time. That was Dr. Bharat Pankhania, their senior clinical lecturer at University of Exeter's Medical School, giving you all the latest on this virus. There's another record-breaking day, of course, 51,000 people